Good afternoon, everyone. This is Jason, and I'm going to present to you today my nurse ethicist that I have been studying the last few weeks, Mary Cipriano Silva. I'll begin with a brief background on her, where she began her career, and how that career has propelled her forward. Next, I'll share with you some of her scholarly works, which in this case were many, but oftentimes short and to the point. Then I'll outline how her work has contributed to nursing in some ways, in this case research and how it has been affected. Then we'll conclude with a little summary about Dr. Silva at the end. Now, Dr. Silva first began her career in nursing by earning her bachelor's degree and master's degree at Ohio State University. She later received her doctorate in healthcare ethics from Georgetown University. She later became director of healthcare ethics, Center for Health Policy and Ethics, and also the director of the College of Nursing and Health Sciences at George Mason University, where she taught ethical considerations. In addition, Dr. Silva served in the American Nurses Association Code of Ethics Project Task Force in 2010, where she helped to revise the Code of Ethics for nursing profession at that time. Dr. Silva believed wholeheartedly in the ethical determinants of what nurses do, not just research and leadership roles, but also at the bedside and the day-to-day tasks nurses engage in. That fueled her desire to enhance the nursing profession as a whole and serve as a guide to better practice excellence in patient care. Dr. Silva also became a professor emeritus at George Mason later on and was a fellow in the American Academy of Nursing. Dr. Silva has many collaborations, but two of her most substantial collaborators were with Jean Merkel-Sorrell and Ruth Ludwig, who also was a fellow of the American Academy of Nursing. You may hear their names repeated during this presentation in regards to the bodies of work presented. As already stated, Dr. Silva had a wide range of publications and research that contributed to the body of nursing knowledge. One of her seminal works was a book publication entitled Ethical Guidelines in the Conduct, Dissemination, and Implementation of Nursing Research, which was published in 1995 and had an annotated bibliography associated with it as well to better aid both nursing researchers and nursing students alike in conducting ethically minded research. Another book publication by Dr. Silva of merit that she collaborated on with Jean Sorrell was that of Research on Ethics in Nursing Education and Integrated Review and Critique back in 1991. This highlighted where nursing research was at that time and where it needed to go. You'll see some of her perspectives coming out from these works in the articles and publications I mentioned that follow. One of Dr. Silva's long-standing platforms for publicizing her ethical perspectives and at times precipitating debates was the ethical column of the American Nurses Association online journal. A collaborator with her on several of these journal entries was Dr. Ruth Ludwig. As mentioned before, she was also a fellow for the American Academy of Nursing as well. Both Silva and Ludwig collaborated for one purpose: to generate thoughts within those in the nursing profession to propel them towards improved patient care and best practice. One of the highlighted and most notable works on the ANA online journal by both Silva and Ludwig, and also highlighted by Dr. Bartlett here on our website, is that of the ethical implications of the doctorate in nursing practice. I won't touch on too much about this right now, as I have more to talk about it later on. Another one of her many contributions to the online journal revolved around ethical considerations for infection control. The article dealt with perspectives of nurses working when they are sick and how that affects patient outcomes, as well as putting themselves and their patients at risk for disease. Additionally, it spoke of calling out other nurses and healthcare workers about practices and instituting a thought process to achieve best practice. One quote in regards to this topic stated by Silva and Ludwig was, "We believe that as attention is focused on the dangers and issues that relate to infection control, that we each should examine the everyday ethical implications of providing care for patients and communities in relation in relation to preventing and treating infection. To Silva and Ludwig, nurses taking ethical considerations into account with their day-to-day practice was essential. This outlines the importance Silva showed in her own dealings with patient care and ultimately the debates that brought to the surface. A large debate that has now gone on for some time centers around the DNP. Silva and Ludwig essentially tried to understand just what the DNP is and what its purpose is for. Ever since the DNP was first proposed in 2004, heavy debates have ensued as to how the DNP will stand up in regards to academics, leadership, and advanced practice as a whole. I know in my own practice and in my own institution I work at, the DNP is not held in regards for tenure track, but that's not the case in some institutions where I know that DNPs are held in tenure track. So in the academic circles, the DNP is heavily debated. Many citing whether its rigor is as substantial as it should be compared to the PhD. And we'll get into some of that here in just a second. Silva and Ludwig suggest that the DNP must be surveyed for how it relates to the social responsibility, respecting persons, doing no harm, and being just or fair. One of the debates on how the DNP is perceived is how those are perceived that pursue it as well. Does the DNP offer any intrinsic value to the profession? I'm sure this question would spark debate just amongst us as colleagues, but it has been pushed out into the community as a whole in the years since the DNP was forged. On one occasion, a psychiatric FNP, or family nurse practitioner, I should say, that finished the DNP program responded to Silva and Ludwig's article by comparing the psych DNP to that of the psych medical program. They saw that there was a need for enhancement, but in general, the DNP could serve to legitimize the nursing profession in the end. Some research has shown that, however, that the APRN, or Advanced Practice Nurse, is not affiliated with nurses in leadership roles. It is more affiliated with those that are licensed practitioners working with patients. Perhaps the DNP can help to legitimize those ancillary roles for leadership, academics, and so forth. The debate will still press on. Another topic that Silva collaborated on with Sorrell was that of informed consent. Now, we've researched informed consent quite a bit in this class, so I think we all have a pretty decent grasp of it. And trying to compare some of the research that's out there currently on informed consent and what Silva and Sorrell actually tried to express, I was able to find some research that was separated by 30 years that kind of highlighted some of the same pieces and perspectives that both Silva and Sorrell were bringing up, still being reflected in what they're trying to research today. A tenet Silva and Sorrell proposed on informed consent revolved around comprehension by subjects. One article stipulated the deception inherent in using placebos for a research study due to some information about the drug being left out. It's a placebo. The whole point is to try to see what effect it will have on them. The study was specifically trying to understand how subjects' attitudes might change in regards to a placebo if the subjects were given more information about the drug beforehand. The subjects were willing to participate more if they saw that any information left off about the drug did not leave out risk or potentially cause detriment to the patient-doctor relationship. This seems to echo Silva and Sorrell's stance of providing a subject with information that is neither too little or too much. Then the researcher at this point has still remained within ethical means. Although these two research articles are separated by 30 years, the studies encompass the same aspects of ethical considerations that Silva hoped to address in attempting to improve research and nursing as a whole. Dr. Silva led an esteemed career that allowed her views of ethics to flourish and ultimately achieve her goal of improving the profession of nursing. Many of her posits are still debated and will continue to expound ideals that will forever change the landscape of nursing and allow for a change to grow that can only serve to the betterment of not only the profession but the society in general. This is the essence of what Mary Cipriano Silva hoped to achieve, and her legacy of achievement will continue on. I hope you've enjoyed this presentation, and I look forward to seeing what kind of comments you give me in return. Have a nice day.